Good day, everyone. I'm Dr. Darrell Wolf, and I'm here with Debbie, and we're in Stuart, Florida. Debbie is hosting the New World Practitioner training that's happening here starting on Wednesday, this coming Wednesday. So we still have 4 spots left for the Whole Life Coach and 4 spots left for the Wolf Non-Surgical and about 5 spots for the Women's Pelvic Restoration 3-day masterclass, okay? We're not here to talk about that, really. We're here to talk about Taz, right?
Yes,
Yeah.
but we can also mention Dr. Wolf is also doing a Day with the Doc on June 2nd, which is tomorrow. So anybody that's in Stuart, Florida, it's a free lecture to come learn about how to heal yourself and take advantage if you can. Tomorrow at 10 o'clock, and you can check out bhnuniversity.com for the address.
But just know it's more of a coming together. It's not like a lecture. So it's going to be like, it'll be like a circle. We call that a Braveheart circle. And I'll be going around and everybody will have a chance to speak. And if you can't come to it, just know we're coming live. Excuse me. We'll be live on TikTok, Facebook. We'll be live on X, otherwise Twitter, Rumble, Instagram, and Telegram. That's enough, eh? And that starts at 10 o'clock Eastern Standard Time and goes till about 2 or 3 o'clock Eastern Standard Time. So the reason why it's that long is it's called Creating the Perfect Day for the Perfect Health. And the reality is this. Did you ever notice something when you don't strategize? Sometimes it goes okay, but who wants to keep rolling the dice? And understand something. You know what? Until you strategize and you actually really take massive personal action, investing into your personal health on an emotional, physical, mental level, then just guess what? You're a statistic. Yeah, you're doing good for somebody that's this age or that age, but you're really not, because the majority of the population is kind of falling apart a little bit. Okay? All right, but we're here about Taz, right?
Yes, we are.
Okay, all right. So what's going on?
So in the last couple months, I noticed some things with him. He had some scar tissue.
Can we bring him over and show
Sure.
who Taz is?
Come here.
Come on. So people can have a good idea. Okay.
So
All right.
This is Taz.
Okay, see?
And so he's an Australian Shepherd. He's going to be 4 years old. And when I got him, they did cut his tail. This breed is known to having, their tails cut, So during this time, I just wasn't paying attention.
So they cut his tail at a puppy.
Yes.
So understand that would be traumatic on a physical and emotional level. You do understand that, right? Okay, that would be like cutting off, the last few inches of your spine. Did you get that? Because it's an extension of the spine. It's actually a dog's antenna. It's actually a dog's balance. Now, when they went and cut the tail off, do you know what they created? Well, what creates more scar tissue than anything else?
Surgeries.
Okay, all right. So when they cut the tail off, do you know what they did? They created beef jerky and calcification. So now, guess what? Whether you think so or not, that dog and every other dog is going to have bowel problems, okay? And the reality is between the scar tissue, the calcification, the crystallization. I mean, the back of his hips and around his tail and his rectum area is all calcified in beef jerky, and people don't get that. So now, guess what that's going to cause? Well, it's going to cause chronic constipation. Now, it's not that he doesn't go to the bathroom, because she feeds him well, gives him structured water, gives him lots of nutraceuticals, and she feeds him well. And the reality is but it's not what comes out, it's what stays in, and that's everybody else. I mean, like human beings wouldn't have smelly armpits, a smelly groin. They wouldn't have bad breath. And halitosis means you have parasites as well. So people can do all the parasite cleansing they want, but if they don't have their large intestine, which is the back door, which is the last few feet of your digestive tract, if it's not open and flowing, then it's stagnating like a swamp, which means now we'll have bad bacteria, we'll have fungus, we'll have parasites, whether you're a dog or a human, same thing. So the reality is whether we like it or not, to make the dog, for the look of the dog, they cut the tail. I mean, humans, we're really funny, aren't we? You know what? Oh, wouldn't it be cute if they didn't have a tail? Oh, that's a better look for them. The reality is this: when we were told that we had dominion over the earth, it didn't mean that we have dominion over the earth and we can just do what the hell we want to do. It meant we're hoping that you have unconditional love for yourself and all the other species on the planet. That would be the deal. So the reality is that, Debbie, you've already been working on Taz, right?
Yes,
and trying to make that happen, right?
Yes, so I've worked, his tail was kind of like, it felt like cemented. There was no skin. You couldn't feel any soft tissue. And so I've worked, and he still has a large piece of scar tissue. And you can actually see the scar that was created, which was a pretty large scar for them, whoever cut it, obviously.
Depends on the mood the person's in. Did that person go in with unconditional love, or did they just go to the chop shop? And the reality is, even though you know where the tail is, it's right at the back end. Well, I just did a little bit of feeling around, and I can feel scar tissue from where the surgery was, and it's right in, and it's actually causing the hips to freeze up. So you have to understand, everyone, when you get surgery, especially if we take a look at a woman who gets a cesarean, right? So they'll cut, it'll heal. You know that scar that she has that's dark brown or black or off color? Well, did you know that you can completely work on that with non-surgical and a cell-sonic, and that will disappear? Now, I didn't say it would disappear the first treatment, but the first treatment, we can always, we see a big change. Like the person goes, oh my God, I can't believe this. And the reality is, usually 3 to 5 treatments, you don't have a cesarean scar. But understand, the scar that you're looking at is not the one that's going to bring you down. It's the actual, they're called feeders. When you cause trauma and you cut into someone, okay, remember something. Human beings have 50 trillion cells. Let's say that Taz has 20 trillion cells that make up his body. So understand, 20 trillion cells came together to actually as a community. Now, believe it or not, every cell is an emotional being. That's right. Did you know that every cell has the same thing that the human body has, organs and even a spine? Okay, the spine is actually made out of amino acid proteins, and that is called the spine of the cells. But I won't get into that. But the reality is, when you cut in, you're actually creating trauma to those individual cells in that area. That creates so much inflammation. That inflammation could actually go to mutation. So instead of that happening, calcium is pulled from the dog's bones that are in the hind end to actually buffer down the inflammation so that they don't become acidic, and then you've got the mutation. So then you lose bone calcium. But now the bone calcium is now in the tissues, and the actual inflammation inflame, okay, it actually is like a flame, and it dehydrates the tendons, the muscles, the ligaments back here. So now you've got beef jerky that is calcified. And the older that gets, just like a river, if I were to put a dam in the middle of a river, we're holding back everything. So he doesn't have flow back here. So he's not flowing when it comes to the lymph, when it comes to the blood, when it comes to the electrical energy, okay, because there's electrical energy in every cell. And that electrical energy, it moves throughout the body, and if it flows properly, you keep your health. So now we've blocked off even the electrical energy. Now, so the older you get, we know that our battery does come down as we get older. I mean, that was the joke's on us, okay? But the reality is that if we can actually make the beef jerky back into beautiful connective tissue and just loosen up the calcium, that calcium will go back into the bone, especially if the dog is on a really good diet and you're using what's called a cell sonic. A cell sonic puts in 25,000 volts as a love harmonic, and it goes in, and here's the one thing that people don't get. How do we actually heal Taz, okay, his whole back end? Well, we go in and we loosen up everything by pulling the fibers apart. So what happened was, let's say that this would be normal tissue. Well, that would be the blood flow, the lymph flow, the energy all gets to flow, right, in between the fibers, right? So with cutting, you get inflammation, and you get this stickiness, and you get contraction. So now you've got what? You've got like a fist near his anus. How would you like to have a fist around your anus? Okay, so we know that he's not eliminating properly. and we know the electrical energy is not flowing properly. So whether we're talking about Taz or we're talking about a human being, remember, if you've gotten surgery, you may say, well, I don't feel any pain there anymore, but it's all numbed out, isn't it? Or it doesn't have any strength, or you feel like you're going to tear it because you don't have elastic tissue. So guess what's going to happen to him? So Taz is young. How old?
He'll be 4.
So he's only 4 years old. So he's just 28 years old, right? If we were to look at dog years. So the reality is he's young enough, and you'd say, okay, well, he should be more spunky. He should have more flexibility, more extension. He should be able to jump up and down. But not if you've got scar tissue back there. It's like beef jerky. If he lets his youth, okay, get in the way of that, because honestly, he's got the back end, okay, of a dog that should be like in his 90s. So the reality is he's tearing that out. How does he tell her? So, he wants to play and run, but then that beef jerky causes micro tearing. And when there's more micro tearing, there's more inflammation, more scar tissue formation, more calcification. And it's just going to get worse and worse until guess what? Now guess what? Oh my God. Okay, he's got hip dysplasia. Or the reality is this. He can't walk on his back legs anymore, and he can't poop anymore. And guess what? I'm going to tell you something. Ready for this? I had friends that had a dog, and they had the tail cut off. It wasn't this type of dog, though. It was an all-white one. So I don't know what it was. But he had his tail cut off. And so as the dog got older, I'm not making this up. Just so you know, these are friends of mine that live in Quebec, Canada. They'd have to carry the dog out because he was so frozen and calcified in here. Mm-hmm. All right. And then guess what he had to do? They had to squeeze him to squeeze the poop out because it just kept closing off. And the dog would be straining, and then the dog was getting hemorrhoids. It was just like a mess. So, you know what? I'm going to tell you something right now. Whether you're talking about the medical system, you're talking about the veterinarian system, remember something, that they are all backed by Big Pharma. They're all trained by them. These are beautiful people that are programmed to just create hell, okay, for pets and humans. And tell me I'm wrong, whatever, you can do it if you want, but you'd be lying to yourself, because don't get me going, okay? Because I'm the guy that gets the leftovers. You get that? I'm the guy that gets the leftovers. She gets the leftovers. And that's because it's so easy to program people about their pets. It's so easy to program people about, oh yeah, I mean, take a look at it. Let me just give you one example. I mean, I could give you an example for everything that's got to do with medical. But look at it this way. Only 3% of chemo works on people, but they're still lining up for it. We know that chemo is derived from mustard gas. We know that when a person has cancer, they're worth exactly in between 250 to 300,000 to Big Pharma. You heard what I just said. You also need to understand that, guess what? When this dog gets his tail cut, and all the other dogs that got their tail cut, this breed, they're all having the same problem. And guess what? Big Pharma comes in. Do you actually think that these guys that are right at the top don't strategize, okay, to manipulate, to create more money coming in and more pain and suffering, whether it's for an animal or for anyone else? I mean, don't get me wrong, this isn't pick on the medical system, Dave, but, chemotherapy is the only drug on the planet that a doctor will make $4,000 if he prescribes it to a patient. $4,000. Seriously? 4,000. So just think if you weren't morally correct. Just think if you were behind in your mortgage. Just think if you lived for money. And I'm going to do something. I'm going to do a talk tomorrow about money. You know what? When money is your first motive for things, you're going to get yourself in trouble. And understand something. There's a lot of people getting in trouble right now because money is their first passion purpose, right? It's the big driver. And understand something. If you let that be the driver, then you're going to make bad decisions. Anyways, I'm a little off topic, but the reality is I'm not off topic because guess what? You're not trained how to look after yourself. You're not trained on how to look after your your dog or your cat. And guess what? You're going to tell me that the veterinarian is trained on how to look after the dog? I'm going to tell you no. I'm going to tell you that there's a really great veterinarian, and her name is Marlene Siegel, and she lives in Tampa. That's as close to I know that there's a great one, and man, she's fantastic. So it's like everything else, you know. If they went the medical route, then it's few and far between.
And, you know, if I didn't go to your class and be able to understand what the body is doing, I would have never, ever thought or really knew what was going on with Taz, because, you know, his symptoms in the beginning were he had a red belly. So he was so inflamed, his you know, where the fur, you can see, you know, the skin, it was very red and inflamed. And he was reaching around and biting his, you know, back in the back end. He was tearing up so bad that he really chewed away all of the fur that was all around his anus.
So the reality is guess what? The average dog owner wouldn't know what's going on. And not because they're stupid, because they're programmed.
And I would have never known that if I didn't take the classes. And I would have been to the vet, and then they would have said he had allergies, okay? And then we would have had to put him on something. But I was able to recognize from learning, you know, through my classes, and started feeling around, and I felt his tail, and that was the first sign that he had all this scar tissue. And I immediately knew that he needed non-surgical treatment, Celsonic, and coffee enemas, because I knew he was...
and coffee enemas, go figure.
Yeah.
So, you know, you can think that we're as weird as anything, but just remember something. So, why was his belly red? Because he was dragging his belly? No, his belly was red because he backed up waste in his large intestine. And when you back up waste in the large intestine, that creates the swamp. The swamp creates what? The infection. He's reabsorbing his waste back into his abdominal area. So that causes infection, which creates inflammation. And if she wouldn't have got that, and then she put him on drugs, guess what would happen? He'd start losing hair from all the inflammation, because inflammation is a high acidic problem, and it eats up the minerals, it eats up the oxygen. So then guess what? The hair starts falling out, because the hair needs proper circulation, it needs nutrients. That's what hair is. It's made out of what? Come on, guys. Seriously. So now, guess what? So if he's got a bowel problem that caused a belly problem, that his belly's all inflamed, guess what? He's been backing up into his liver. And maybe you want to explain when you started doing the colon cleansing and the coffee enemas. Maybe you can explain it a little bit.
So I first, I just went in with a little warm water and Tummy Love, just to start him out and see if we could clear out the bowel and get him to evacuate some of the poop that was in there. And then I went to the coffee enemas, because I want to try and have that bowel clean so that we can get up to the liver. And in the second, at the first coffee enema, the redness decreased by about 50%. And after the second one, he was like almost back to normal. So you know you're doing the right thing immediately, because you can actually see the changes immediately. And then I started some non-surgical, you know, on his tail and in the...
Yeah, and if I can say something, just like you did the ultimate coffee enema.
Yes.
If you actually did a warm water, structured water enema, and you added Tummy Love to it, and you had a little baby or a little child or yourself, and you had a fever, goodbye fever.
Yes.
Oh no, you don't want to do that, do you? Because it's too foreign to you. If everyone else did it, you'd do it. So since everybody else is opting for, let's go to 911 emergency route and then do antibiotics that knock the living crap out of our immune system and then actually cause a worse problem down the road. And that's what the majority does, not because they're dumb, because they've been programmed. Okay.
So, and since then we've been, you know, doing the Celsonic and doing some non-surgical, and continuing the ultimate coffee enemas. And so now we're going to do a little bit more work, and he's going to work on Taz's hips and a little bit on his tail. And we're going to see if we can get his joints back open and put him back to where he needs to be. So for 4 years
And
old.
just know, for most people, you know, I get it. They're not going to do this because everybody wants it easy and everybody wants a shortcut. Well, we all know what happens with the shortcuts we've been doing with our pets and our family, right?
Yes.
Okay. And they're not shortcuts. They get to be long cuts. And then you just get to keep cutting. Okay?
And Taz has been on a raw diet, and he has eaten the best food since
Yeah.
he was young too. So this is just to show you that anything can go on, as you know, when they do cut and make that incision into that animal or person. So you may have to have the non-surgical and the Salsonic, which are two of the most beautiful things on this earth. I mean, it's just amazing that
Whether it's a dog, whether it's a
Yeah.
cat, whether it's a human being, understand this. I'm telling you right now that Wolf Non-Surgical will give you a money back guarantee, whether it's your pet or yourself. Do you understand? Whether we like it or not, we're not that far from being animals. Okay, we are built like them. Please try to consider yourself and your pet the same thing. What's good for you is good for your pet.
Yes.
Okay, with a high vibrational lifestyle, proper circulation, proper elimination, right?
Yes, and also he's also my first dog that I've actually had to cater to give him water. This is a dog that really doesn't want to drink from a bowl, and especially after another dog has drank from it, he likes running water. So my house is structured with a house structure unit, so he can drink out of the hose. He does still get structured water, and I just make sure I always have water, and I just keep a small bowl, because even as big as he is, I know I'm going to be filling it up multiple times during a day, so he can have his fresh water. So we make sure that his intake,
Everybody has a personality,
yeah,
right?
and he is one that I really have to watch if he's getting enough water every day. So he is a challenge as far as that goes. But he'll do. But he gets the detox tea in his meals twice a day, and I make sure he gets extra fluid in there. That way he's drinking more, just so we make sure he gets enough fluid intake. And so he gets it, he eats it and drinks it. So anyway.
Very good. So look at it. If you have a pet question, I mean, you can call me, and you can also call Debbie. And Debbie's, I don't have pets, but I've been working with them for years. Now Debbie has pets. And so if you want to call her,
you can reach me at 305-342-9559. And you can check out my clinic. We're here in Stuart. It's Stuart Health and Healing, and the website is stuarthealthandhealing.com. And you can check out, we do personal consults. We have the Salsonic, we have the Bioptron, we have a vitamin D light. We do non-surgical. We work on people, we work on dogs, pets, anything. Just call us and talk to us. And if you have any questions about the upcoming classes and you want to take advantage of learning how to do this yourself, it's changed my life. I've been in the medical field for 30 years. And in the first week of my first class, I learned more than the last 30 years, and understanding why the body does what it does and what to do about it. I would have already been to the vet probably 2, 3, 4 times with this dog over the last couple months, and probably spent, probably $1,500 easy. I mean, they would have done x-rays, they would have done blood work. It would have been $1,500 to $2,000 just on the dog. And guess what? I was able to treat the dog and do the work myself. And if I need to, I always have Dr. Wolf to consult with, or one of the other practitioners. And we work together to get the answers and get this solved. Right now, Taz is growing the hair back. So we know we're on the right road. He still needs some work, but that's the patience that comes along with doing this. Nothing changes overnight. And when you do a treatment, we can't go right back in and do another treatment. We have to give the body time to heal from that treatment. Mm-hmm. So we just go nice and slow. And he's making improvements. But we know he needs to get a little bit more work done, right?
Yeah, and just know this, whether you're talking about veterinarians, you're talking about the medical system, anybody in it, that would be a veterinarian, but they're all trauma queens, and they are. Okay, everything's an emergency, everything's in, and you don't have to, if there is really a life-threatening situation, then go to them. But if it's not life-threatening and you don't want it to become life-threatening, then you better take massive personal action. and understand about your own body and your pet's body. And that's really going to be important. We would stay on video, but the reality is I want to give Taz my attention. So Taz will be sitting on Debbie's lap. And then what we're going to be doing is I'm going to be doing non-surgical on his hips and on his back end. And we're going to go in as deep as we can. Now, what we're going to do is we'll do the Cellsonic prior, okay? And we'll do about 250 pulses. And we'll go in with a harder pulse, not a harder pulse, but a more powerful pulse to actually go in there and decalcify at the mitochondria level, because they have mitochondria too. They're made the same as us. And we'll decalcify the mitochondria in the cell. And we'll also decalcify the calcium outside of the cells that is actually in the joints. That's called arthritis, guys. And then what we'll do is I'll do the non-surgical to pull the fibers apart. And then we'll go back in and we'll do Cellsonic again, but at a lower vibration, so it stays longer and it helps with the healing. Okay. So if you're interested, make sure you give Debbie a call, or you can check out our website. And if you're interested in maybe taking one of our courses, like the Whole Life Coach course, let me tell you something, and I mean this. You know, why wait until you're on the edge? Why wait until you lose it? Wouldn't it be great to be able to process your emotions, actually know what real nutrition is? Most people that call themselves nutritionalists don't even know what they're talking about. I apologize, but they don't. You might think I'm being conceited and arrogant, but I'm not. If they did know, then why are things a bloody mess? You know, let me put it this way. When I see nutritionalists and dietitians and naturopathic doctors and the medical system start giving money back guarantees like we do, then I know that they're on the right track. Until then, I think that they're full of BS, dysfunctional belief systems. You can take that to the bank. Go take it, and you want to check us out, please go to braveheartnation.com if you want to check out our courses, and if you want to check out and challenge my theories, my philosophies, go to docofdetoxlibrary.com and watch any of the masterclasses. We have more masterclasses, more training than any other library in the world, natural health. And if you want to do something and download what I put together called PDG Free, it's called the Perfect Day Guide. Trust me, it'll be the best gift that you've ever read. And it's my gift to you, pdgfree.com. You have the best weekend of your life. And remember something, wear a slight smile, no matter what's going on, okay? Connect to your breath, stay in the moment, own it, because that's the only place you can heal yourself or your pet. Debbie?
Yes, guys, it's just truly a blessing, and I love this. I love that we're able to show the world and help people that really want to know how to heal themselves and heal their pets. And I feel very blessed, and I'm excited for the next few days. It's going to be a lot of fun starting these courses. And
we'll be live tomorrow at 10 o'clock Eastern Standard Time if you can't come to us. But if you can, we'll be at the First Presbyterian Church in Stewart. Okay? All right? And you can find that information up at braveheartnation.com as well. The lecture information's right there. I don't know what else to say except have the best day of your life in 3, 2, 1.
We got this.
Together we're stronger.
Bye.
Bye now.